If you're interested with non-surgical aesthetic procedures, just click the subscribe button and the notification bell so you'll get the latest updates in the science of non-invasive and minimally invasive aesthetic procedures. Hi, I'm Dr. Contessa. Welcome to the CSA Certified Skin Authority. In today's episode, we have a special topic. It is about hollow temple. How to correct, how to augment a hollow temple. We have with us right now one of our facialists here at the CSA Medical Aesthetics, Miss Rosel. So let's all welcome Rosel.
Good day po mga ka-CSA.
Yeah. So Rosel, how old are you?
I'm 32 years old na po ma'am.
Okay, so she's in her 30s already, and we have learned in the past that aging may start at the age of 25. So right now, Rosel is with us to correct some of the signs of aging. Okay, so we have to do some facial assessment to determine which part of the face should we address or should we manage to delay the aging process. And when we do a management, we have to assess and we follow the rule of thirds, that is the upper third, the middle third, and the lower third. So looking at Rosel right now, okay, sa upper third, what we see, what we check, the forehead region and the temple region, and also the upper portion of the orbit or the eye area. Now on the forehead region, can you raise the eyebrow for us? Okay, we see some dynamic lines. Can you frown for us? So a little bit of a dynamic frown line, and can you smile for us? Okay, so on the corner of the eye, what do we check? Crow's feet. So for now, I don't see on the superior area, but below it, inferior area, there are fine lines already. Now, looking at the temple section of Miss Rosel, so we notice some depression already or some form of hollowness. Okay, so this part, okay, if you check the upper third of the face, the temple region, there's a beginning volume loss. Okay, so she's in her 30s. Okay, we may expect this already at that age. And then, looking at the middle portion of the face, so we check on the infraorbital, the tear trough region. So we notice already depression also or volume loss in this part. Okay, and then the cheekbone, I'm starting to notice some sagginess already or a beginning downturning of the cheek region. Okay, so I think Rosel is also noticing that already. And on the lateral view, it seems like there's already a flattening of the mid-face. You are losing already the so-called OG curve, the natural curve of the mid-face. Okay, there's this convexity that we have in the mid-face region. Now, going to the lower third of the face, okay, from the subnasale to the chin region or the mandibular area, okay. So actually, I think Rosel is happy with the shape of her face. It's like a rounded or oblong shape. So actually the ideal face for women, oblong shape, but right now they're doing the inverted triangle, right? The ideal facial shape for especially women. Okay, I think there's a good curvature on the lower third of the face. Now, what do we have to correct on Roselle? What is the main concern right now? Actually, she told me a while ago that she wanted to correct temple region and the under eye region. So these are part of the upper middle third concerns. Today, we will be starting with correcting upper third. That is the temple correction or the temple augmentation. Okay, then in the following treatment, we can do the under eye correction. Okay, so Miss Roselle. Okay, so how are you feeling right now?
Kinakabahan po, Dok.
Okay, kinakabahan si Miss Roselle, okay. And you haven't experienced any kind of a treatment like Botox, fillers, threads, lasers?
Botox po, Dok.
Botox. She has tried already Botox, okay. Oh, that's why she still has a very good forehead region. And also this one. Where did you have your Botox? Okay, so that's why your superior border is free of crow's feet. So we just missed the one below this one here, the inferior or the infraorbital section. Okay, so what we're going to do with Miss Roselle is to correct the temple region. And let's find out what kind of treatment, what product are we going to use, what will be the technique to correct the temple hollowness. So ating abangan yan sa pagbabalik ng CSA Certified Skin Authority. So we're now going to demonstrate the so-called temple augmentation. Before doing the procedure, we have to do some surface land markings to determine which will be our entry point. So I made on the other side, the left side, already some landmarks here. The first one we did was the diagonal line from the center of the chin, then to the corner of the mouth, up to the zygomatic region, to the tail of the brow, up to the hairline region. So this is a diagonal line, center of the chin, corner of the mouth, to the zygoma region, lateral portion of the eye, to the temple, to the hairline region. Okay? So another landmarking that we have to also identify will be the borders of our temple region. We start with the temple crest, this part, or the temporal fusion line here. So we have to make a marking on that one. So from the brow region to the hairline. And then palpate also for the lateral orbital rim. So here's the lateral orbital rim. And then also palpate inferiorly the zygoma, the zygomatic arch here. Then make a connection. And then superior laterally will be the hairline region. So this is now the borders of our temple area. Okay, so in doing also or finding the entry point for our temple augmentation, we have to make a measurement from the temple crest about 1 cm perpendicular to the temple crest, and then 1 cm perpendicular to the lateral orbit. So that will be our injection point or entry point for the material that we will use for augmenting our temple. So ideally, the diagonal line should be intersecting that injection point also. Then make a horizontal line from the highest point of the eyebrow to the hairline region to locate the entry point for our temple augmentation. So this circle here is our entry point in injecting a product to augment our temple. Okay, So we also have to be aware of certain structures that we have to avoid in doing injections of our temple. So what are those structures? We have to be aware that there is a superficial temporal artery, and for you to find out where it is exactly located, you can actually feel the pulsation on this region. Most of the time, it's near the hairline area, so try to feel for any pulsation. Okay, like this one, this part, there's a pulsation. So we have to make a marking of the presence of the superficial temporal artery, and this one will branch out into the parietal branch and the frontal branch. Okay, so actually there's also a transverse facial artery here, and at the same time there's also a small branch of the zygomatico-orbital artery going here. Now you can also look at the patient's skin. You may be able to look for some sentinel vein. Like here, I was able to locate a sentinel vein here. So on this side, I cannot really visualize the sentinel vein. Just a little bit sentinel vein there. So you have to avoid those vascular structures, okay? And another thing that you also be aware of is the branch of the facial nerve, okay? The facial nerve comes out from this tragus region, and there's a branch going to the temple. So actually that nerve is near the artery or the vessel, okay? So once you have already your landmarkings, it is already safe to do your injection for your product, okay? So actually, I want to just add, there's an X mark here for the infraorbital foramen where you have infraorbital blood vessels and nerves, and a tiny one here for the so-called zygomatico-facial foramen where you have zygomatico-facial artery here, okay? So this one is the zygomatico-orbital artery. It's a tiny vessel. So we have to be careful with all these vital structures in our temple region. So in doing a temple augmentation, anatomy review is very important because there will be some, well, I should say, complications that could be devastating whenever we have hit an artery or a vessel. Okay, that's why it's very important that you go to trained physicians in doing temple injections. Okay, so now we have seen our landmarks. The next thing that we have to know, what product material should we use? Okay, in this episode, we're going to present to you our Restylane Lift with lidocaine. So this is a hyaluronic filler with a high G prime or high viscosity property. And I prefer using this for my younger patients. Plus, it really gives that better contour, better shape of our face. It has a very good lifting superior border, and the hairline, those are the borders of our temple. And then following the diagonal line and the horizontal line from the highest point of the eyebrow to the hairline. Determine if you still need to add more on one side just to balance left and right. Okay, so you have to identify if there's still a deficiency on one side, then add more volume on that side. Are you still okay, Rosel? So I'm just pushing the product slowly. The thing with Restylane Lift, it's a viscous material, so when you push it, there's really a kind of resistance. And for me, that's an advantage, so that the doctor will not really pushing the material instantly. You okay? No discomfort? The good thing with the Restylane, it also has a lidocaine, so it's already giving that numbing effect on our patient. So take note, my injecting hand and then my non-injecting hand, I use this for support. So I'll be pushing the entire 0.6 already here, because during my assessment, I noticed that the left side is more hollow than the right side. Okay. This is a hyaluronic dermal filler, and it's hydrophilic. It absorbs water 10,000 times. So advise your patient to drink more water, so in the coming days and weeks and months, they still notice more fullness, more volume restoration on their temple region. And we've mentioned that once the temple has been augmented, it corrects also sagginess in the mid-face to lower face areas. And it also helps in giving highlight on the shape of the face. Like if you are wanting to enhance facial shape, like the inverted triangle or the so-called triangle of youth, then just do injections chin, cheek, and temple area. Then you can restore that natural, younger facial shape. So the others are saying right now the hugis bigas, the shape of a, what do you call that, the rice particle, something like that. So the trend right now is to have a slimmer, narrower, smaller face. I'm just very gentle and very slow, because this is a section whereby we have a lot of vessels, and you know, it's near the orbit, so we have to be very, very gentle. So I'm already noticing a fullness on the left temple. While I was doing my assessment on Roselle, I noticed that there's the so-called asymmetry on your face. So the first thing, the temple, there is more hollowness on this side. And also, I was doing this diagonal line and I noticed how narrow her lips are, or the mouth is narrower. And since she has a smaller face, okay, and when I was doing this diagonal line, I was expecting the line to be somehow lateral, okay, but hers was near the lateral canthus of the eye. So do massaging or molding technique, you have to spread the filler inside the temple region. Okay. So that's basically temple augmentation using our Restylane lift, which has a high G prime, high viscosity chemical property. Okay. Okay, Roselle, how did that feel?
Parang ang gaan lang ng kamay ni Doc. Sobrang lang. Wala
Light.
lang, relax lang po.
Yeah. The good thing with the product, it also has the lidocaine already. That's why there's a lot of, should I say, our clients are saying it's not really that painful. It's just that you feel some heaviness, right? Somehow there's heaviness, but it's really tolerable. Okay, so we did our injection of the Restylane lift temple region. Okay, and we have shown you important landmarks, vital structures to avoid, injection technique, product material, how much of the product material to inject. So basically, those are the important inputs, important informations to learn about temple augmentation. So here's the mirror for Roselle to see the result. Okay, Roselle, there you go. Look at the temples. Yan.
Ayan po.
Yeah. Right. Umangat na, sabi ni Roselle. Okay. So actually, I myself am visualizing a fullness of the temples, the right, the left. Okay. So it's an instant result from our Restylane lifting and immediate lifting of the temple region. And I also noticed that the corner of the eyebrow as well as the corner of the eyes, they were also lifted because we injected this section here, okay, near the temporal fusion line and near the lateral orbital line. So there's this effect, an immediate lifting effect for the corner of the eyebrow and corner of the eye area, as well as the zygomatic region. So with the fullness and the volume restoration of the temples, it will really give a big impact in reducing the sagginess or heaviness of the face. So it will also help in restoring that natural facial shape, like the inverted triangle or the oblong shape, the ideal facial shape for women. Okay, Roselle, ano bang masishare mo sa ating mga viewers?
Ano po, bali nakita ko po agad yung result. Tas, while doing the procedure po, sobrang gaan ng kamay ni Doc. Hindi ko nga po naramdaman. Medyo may part na nagugulat lang, pero sobrang gaan po, promise.
Yung nagugulat niyan, sometimes kasi we have to touch a little bit yung sa bony part, dun sa tip ng needle. So, but that is just like a second lang and it's okay na. And once we push na the filler, may lidocaine, so magna-numb pa siya. And then what we advise to our clients, they have to hydrate themselves, drink a lot of water so that the filler will absorb more water and it will have a more fullness, it will still plump up, it will still volumize. So we are using the natural hyaluronic dermal filler, the Restylane. It's actually the market leader, the pioneer in terms of hyaluronic dermal fillers. It's a very good product, very safe, clinically proven safe, scientifically studied, plus it gave that instant natural lifting result and it enhanced the natural features, it highlighted the natural shape of Miss Roselle. Okay, so we're all happy.
Yes, Doc.
Yeah.
Happy.
So thank you so much, Roselle, for
Thank you rin po, Doc.
being our guest and sharing your experience to our televiewers. And sa inyong lahat, maraming salamat din po sa patuloy niyong panunood. Kung meron po silang katanungan, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the second floor Pure Gold Dao Building, Dao MacArthur Highway, Mabalacat, Pampanga. Contact numbers 0933-860-9193 or 0917-504-4268. We also have our FB page, CSA Derm Centre, Instagram, CSA Derm Centre. Okay, so yung iba naming mga videos, they are in our YouTube channel. So please do subscribe, and also the notification bell, you have to click it so that you'll also receive updates in this procedures, aesthetic, non-invasive, and minimally invasive non-surgical procedures. Okay, so maraming salamat po. When it comes to natural beauty, you can trust the CSA Certified Skin Authority.